I got like a lot of feedback from about our last talk where we were talking about the vaginal rejuvenation and the sexual problems that women face when they're perimenopause, menopause. So a lot of women actually texted me and also called and met me asking about that. They wanted to know, is there a downtime? What do we do? What are the procedures available? So basically in my office, we have a laser, which is called FemiLift. And FemiLift is something that women use as we get older. We get really dry, and that's when a lot of problems and urinary tract infections and even sexual decline starts happening around that time. So this is recommended. I recommend it doing once a year at that point, and sometimes in combination. We work very closely with your gynecologist because you have to have a recent pap smear that has to be provided, and it should be normal. And the other thing is that I like to also look at your hormones, so to see like where you are in the trajectory of your health, because sometimes we take care of every part of our body, but we ignore the parts where sexuality, especially female sexuality, is concerned, and it's a very important part of your overall health and your brain. It's not that important when you're like especially when we are very young, we're just exploring. That's and you guys don't have any problems, but especially when you start turning into your late 40s or 50s or 60s, and then even further than that, it really starts declining, and it's one of the first signs of aging, of an aging body. So very important. I invite women to go and find providers like myself, and right now there's like so many providers like myself, like almost everywhere, in every town you would find somebody who's really good, who is doing appropriate anti-aging treatments, and there are like a lot of spas, but you also have to be careful. Don't settle for a spa that is does not have doctors there. You have to have doctors, and for something like FemiLift, I would say go to. I prefer female doctors, but a lot of women who come to us, they're like really. But we also help men. So men should also treat. There are like a lot of therapy places where they can go, and it's like a very thriving business. It's like really a lot of people are doing it, and a lot of people are seeking this help because none of this help is considered essential, and it's not really covered by insurance. So for men, there is like, if they have sexual dysfunction, they go and get Cialis, but for women there is really nothing. There is like a pill that they just recently got approved for this thing, but none of the insurances unfortunately cover any of this thing. And that is one thing that I also want to talk about. Like we gotta change. Because aging starts affecting people by the time they start, they go and get into their 60s or middle 60s and stuff. And that around that time, most people are on single incomes, and they cannot really afford any of the treatments that they used to get when they were younger. So that is the thing. So what are your when you go to your gynecologist, do they ever ask about your sexual health and this and that or whatever?
I don't recall, because we're talking about so many other things. I mean, now that I'm coming into perimenopause, I feel changes in my sexual health. Like I feel like my mind my direction is going in a different way. Like sex is not on my mind.
Okay.
The way that maybe it used to be.
Well, you're more selective, so you don't
Yeah.
have to be that. But like,
Yeah.
so it's your hormones are like.
Do I get turned
Something-
on? Is that what you want to know? Yeah. If if the guy is hot, I'm like.
So
yeah,
you're capable of
Yeah, I am.
turning into
Total, a sex fiend.
yes, exactly. That's it's not like, all right, nobody can.
No,
I'm not
yeah.
bothered by anything. I'm like,
but I feel
I've
like
achieved nirvana. I'm like, I haven't.
but I feel like, and I don't know, like I'm speaking for myself. For me, getting turned on sexually is a mental thing. Like you have to stroke my mind. It can't be like, hey baby. It's gotta be like, hey baby.
Don't touch my hair.
Oh,
Laura
I know, we
did
just did it.
Okay, no, kidding. That was
No,
a joke.
so-
But she's totally right because when
Yeah.
you're totally right because when they have done women's fMRIs, they have checked how a woman's brain actually lights up under the under the MRI machine and stuff. Functional MRI, it's imaging of the brain, and a woman's brain, the way it lights up is totally different than what a man thing.
So
And I
it
was
is
looking
right.
at that. They have done like a full documentary, and it's like so fun. I'm gonna actually post it in this video if anybody is interested
That's so
at some
cool.
point. But it is so
Yeah.
cool. So you're totally right. So women's or you're talking about not just turning on, but also so that is different. These are different categories. You have to learn and unlearn certain things.
Right. I feel like
to remain youthful.
somebody texted me, "Good morning, beautiful," and I was like, "Ooh!" I got all excited. I was like, "Oh, all the juices are
Oh no, that was
flowing."
just me.
Oh,
Just kidding.
text me every day. It's all right. As
Nobody texts me, "Good morning."
as the juices are flowing, it's all good. Text
Well,
away.
thank God nobody texts me that because if somebody says that, I'm like, what the fuck you want? Get out of here.
Not me.
I'm
like,
not.
"Woo."
I'm busy.
Hey,
I'm doing my thing. I'm good. I'm good. Please. Don't come here. Just listen to my podcast later if you want to talk to me. All right. So very important.
Yeah.
I would say please go and visit your GYN. A lot of gynecologists that I know are amazing. They always talk about feminine, not just health and prevention and everything, but they also figure out how women are doing. Because in this department, the moment you start aging, you have to figure out can we extend it a little bit. It will just enhance the quality of your life, the quality of your connections, if you keep it. I tell women that it's your a little bit of a burden of doing everything is also on us to have an open mind.
But I also feel that as we're coming into our 50s, our children are grown. For myself, I mean, my older daughter's 26, my younger daughter is 14, so they're self-sufficient at this point. So now I feel that it's my time to invest now in myself and take care of all of these little important things to prolong my longevity.